What does private equity want in a practice partner? Find out on Medical Economics.
Cultural fit is absolutely important. It's not just about the money. It's about whether you want to sit across the table from these business partners late at night, early in the morning, and making business decisions with them.
Representatives of a private equity firm come knocking on your door, looking to buy your practice. What should you do? Physicians are no strangers to such purchase offers. For years, hospitals and health systems have been buying independent practices. But private equity is now a large and growing player on this stage, and the potential benefits and risks to your practice can be a bit different. What are these firms looking for in a deal? And what are the benefits and drawbacks for physicians from these purchases? What do physicians need to know before they sign on the dotted line? Today, we sat down with attorney Rick Zall to talk about what physicians must consider should a private equity firm come knocking. In our cover story, you told us that investors are looking for a platform practice. What does that term mean?
A platform practice is the foundation on which you can build a bigger business. So it needs to have sufficient size, scale, multiple offices, and enough revenue and profitability that the PE firm can build on it.
So for physicians, working on the ground, what are the potential benefits of a private equity firm acquiring their practice or hospital?
First I'd say it's capital for growth. To buy technology, to open new offices, to hire more doctors. It's also to get a business partner who can help with relationships with payers and vendors, help bring in managers to run the business.
Okay, so let's say I'm a physician and my practice received an offer from a private equity firm. What should I do first? What are sort of the things that I should consider as I mull over this offer?
I think the most important thing is not to move too quickly because that offer might not be the best offer, the only offer. So I think first step is to decide, do you want to partner with a private equity firm? And then if you do, bring in advisors who have worked with private equity, who can tell you the universe of potential partners. And then also look at your own business and understand that you're going to be examined from top to bottom by the PE firm. So you better get your house in order. And there's work to be done before you really are sitting across the table with a PE firm.
Obviously, each deal is different, but in general, how is practice valuation determined usually in these deals?
It, like many other businesses, is based on a multiple of profitability. So what the PE firm will look at is, how have you performed over the last couple of years? Are you making money, and how are you making money? Are you opening new services? Are you adding doctors? Are you really running profitably or not? And then secondly, is the business well managed? Do you have a management team that can take that practice to the next level?
How does private equity acquisitions affect physician ownership of practices? And then for those physicians who aren't owners, how does it affect salaries?
So the first thing to know is that there are corporate practice of medicine laws that prevent non-professionals to buy physician practices. So most of these deals involve the creation of a management company, and the PE firm is taking ownership of part of that management company. They're then paying the physicians for a multiple of earnings, and that will involve usually some adjustment to salaries and compensation. So the physicians need to look at that. What the PE firm will do is it will look at market compensation, and before the PE firm arrives, the physicians are getting paid a market salary plus a share of profits. Once they sell, in effect, a share of the management company profits, their take-home pay is going to be reduced. Now, they will have received a big check, but over time, the question is, will the compensation increase? If the business is profitable, it should.
So you had mentioned before that, if you get a private equity offer that, maybe you want to kind of pause and sort of consider other offers and those kinds of things. So I'm just wondering, if you get that offer, what are some of the red flags you want to look out for when you're kind of vetting one particular offer?
Well, I think that you want to be sure that the firm has experience in your field. If you're in ophthalmology, that they understand the ophthalmology market so that they'll be good partners. If they come in and they don't really have a familiarity with your practice area, that's a red flag that they're not going to be able to bring a lot more than just money. So again, I think the key is to pause. If you decide you want to go that route, bring in advisors who can find the PE firms that have the right experience and conduct a little bit of an auction with those so that you really see the range of opportunity that you have, and then you can pick the partner that fits best with your business.
So how does a potential private equity acquisition affect physician ownership and physician salaries?
Right, so the way a private equity firm will work is they will pay for some ownership interest in, say, the physician's management company. So the physicians are going to be giving up some portion of profitability. That will potentially reduce take-home pay in the short term, but the objective and the plan is that with a private equity partner, the business will grow and compensation will not only be restored to what it was, but distributions to the physicians should be higher.
So what is typically the end goal of a private equity acquisition? Are they looking to be long-term partners, short-term partners? Does it vary? Can you just break that down a little bit?
Right. It does vary by which PE firm you're talking about, so you need to understand what the objectives are. But for most, it's a midterm relationship. It's grow the business to the next level and then either sell to another private equity firm or in some cases go public. But most of the private equity firms have funds that have lengths of time where they need to liquidate the funds. So it's usually 5 to 7 year term.
How important is cultural fit to these acquisitions, sort of meshing between the physicians and the investors?
Cultural fit is absolutely important. It's not just about the money. It's about whether you want to sit across the table from these business partners late at night, early in the morning, and making business decisions with them. So learning more about the people, having multiple meetings with them, socialize with them. Are these the kind of people you want to spend your days and nights with?
So as a physician, if you wanted to make your practice attractive to private equity investment, what sort of things should you focus on?
First, quality. Really hire and bring on as your physician partners, physicians with the best credentials and the highest quality, because at the end that's really job one that makes a practice successful. Two, bring in business managers who will operate the business efficiently, because that's the second thing that a PE firm will look at. And grow. Always have your eyes open to opportunities to add sites, add new services, and be a significant player in your market.